I want to make this video to poll you guys, the audience, about how do you go about preparing to meet with a jaw surgeon for a consultation, and then how do you compare and contrast what's being recommended to you by different jaw surgeons and ultimately pick one to do your treatment. So I'm going to tell you some thoughts that I've had initially, and then I want you guys to blast the comment section with insights, because Lord knows that I learn just as much from you guys as you learn from me. So some thoughts that I've had. Number one, I would say see multiple surgeons, 2 or 3. Get them to give you a surgical plan that's illustrated, shows your face, the silhouette of your face, with lines and metrics and measurements, and then how the jaw surgery is going to change that. So essentially a before and after with specific jaw surgery movements and magnitudes of those movements shown. I would get 2, maybe 3 of those from different surgeons, pay for them, okay, it's an investment into R&D, and then I would compare and contrast, and I would identify the differences between the jaw surgeons. And then I would ask, okay, why is this man telling me to make this movement? For example, maybe he's telling me I need a downgraft. And yet this surgeon is telling me I need an impaction. Okay, time out. We have a difference. We don't have a consensus. We need a third opinion, a tie-breaking vote, but what would another great surgeon do? And then we can establish a consensus.
Use the right 2 lanes to take the exit onto Massachusetts Turnpike East and I-90 East toward New Hampshire.
I think that, so in what that point gets into is, how do we get more granular in our understanding and our assessment of surgical movements?
Take the exit.
I think that, for me personally, I'm very much stuck in, how much am I going to be expanded? How many millimeters forward? Okay? But I think you can get more precise than that when you're analyzing a surgeon's proposal for you. So tell me in the comments, guys, what are some more microscopic terminology that we can use for surgical movements in an MMA surgery?
Continue straight.
Because that's something I want to learn more about. Okay, another important question that needs to be figured out before you pull the trigger on a jaw surgery. Do I need a nasomaxillary expander first? Am I going to do an MSE, a custom MARPE and ease before the jaw surgery? And this is actually a really hard question. You have, a lot of orthodontists that swear by MARPE and want to keep people out of jaw surgery. And then you have a lot of jaw surgeons. For example, I heard Benjamin Wallin himself, not from his mouth, but a patient told me that he said that he is seeing MARPE be way overdone, and that a lot of patients would be better off just going right into jaw surgery, getting a segmental Lefort, rather than going through a multi-year orthodontic process for getting nasomaxillary expansion. Because of course, after the expander, which is essentially a bomb going off in your mouth, you have to clean it up orthodontically, and that's slow. The tooth movement after the expander is definitely the rate-limiting step. It's just a lot to go through. So is it really necessary? How do we know if it's necessary? I did ask Casey Lee that question in my interview with him. I think one of the key criteria is, do you have severe nasal obstruction or even significant nasal obstruction? Because I don't think that a segmental Lefort can really be counted on to give you nasal airway relief. I do think you need that more robust TAD-based expander, doing the nasomaxillary expansion to get that robust change in your nasal aperture. Okay. I think another consideration is, where am I on the aesthetics versus sleep apnea spectrum? Am I doing this primarily to look better? More precisely, am I willing to sacrifice some airway benefit to get a more balanced aesthetic outcome? Or am I one of these patients that's ready to commit suicide because I'm so miserable from my sleep apnea, and I just want to expand as much as humanly possible to be sure that when I come out of that surgery and I recover, my sleep problem is cured? Those people might be more willing to endure a little bit of that crocodile face, where the lower part of their jaws from the Lefort cut down is very drastically advanced for airway benefit, but maybe at an aesthetic compromise. On that note, I think another interesting question to be discussing with your jaw surgeon is, what are we doing with my cheekbones? Are we going to do a MARPE for my cheekbones? Because, of course, the nasomaxillary expander flows uphill to the zygomas and you get a little pop there. Or do you think that my face will have balance even if we advance the lower part of my jaws from the Lefort cut down without doing any kind of cheek implant? If we're going to do a cheek implant, what's that going to be like? Is it going to be silicone? I don't love the sound of silicone. Is it going to be some kind of bony implant, like a genioplasty for the zygoma, where you actually cut the tip of the bone off, plate it forward, and then let the body heal it into a new bona fide bony structure? I defer to Lori Hill, another YouTuber, on authority when it comes to pure cosmetic enhancement treatments like cheekbones, but it's definitely something I want to learn more about, and it's definitely something I think should be part of the conversation around, constructing a new face for yourself if you're interviewing with top surgeons. I think another good question is, what are we doing with my nose? Am I getting any kind of nose job with my jaw surgery? I know Mirko Raffaini loves to do a nose job with a jaw surgery. Maybe it's a functional nose job. Maybe they're not just doing a cosmetic rhinoplasty to straighten your nose or to make it narrower or smaller or whatever they're going to do. Maybe they're also going into your nose and cutting out some excess nasal tissue, a turbinate reduction, a septoplasty, a sinus tissue removal, polyp removal. There's a million things you can do in your nose to relieve your nasal airway at the hands of an ENT. So those are some top questions I would ask, and I'm very curious to hear what you guys have to say about these questions and other considerations when meeting with jaw surgeons. Please let me know for the benefit of the entire community, because I think a lot of people meeting with jaw surgeons sort of just show up with to quote The Godfather, with just their dick in their hand and not being armed with the appropriate questions to ask. And then because surgeons tend to be very dominant personalities, I think if you're not kind of ready to parlay, I think you could end up getting plowed through by the strong personality of the jaw surgeon. Anyway, let me know. Peace out.